Knock.
Hello.
Hi, my name is Briana. I'm going to be your nurse practitioner today.
Okay.
How are you doing?
I'm doing good. I just came in. I have a runny nose.
Okay. Can you tell me your name first?
My name's Jessica.
Jessica. Nice
Yeah.
to meet you, Jessica.
You too.
Okay, so I'm going to wash my hands and ensure privacy. Do you have any questions or concerns before we get started?
No, I'm just for my runny nose.
Runny nose.
Yeah.
Okay. Okay. So we have the medical assistant already came in and did your vital signs, took your vital signs, height and weight, and all of that looks great. Your BMI looks great.
Okay.
As I'm looking at my patient, I can see that her skin color is normal for her ethnicity. She has good hygiene. There's no odors. She's dressed well for the weather, and nutritional status seems good. Some identifying data: she's a 32-year-old female, Caucasian, with clear speech. She maintains eye contact. And her chief complaint today
A runny nose.
is stating she has a runny nose. Okay. So when did this runny nose start?
About a week ago.
Okay.
Yeah.
What color is the discharge?
It's clear.
Clear.
Mhm.
Okay. Is there anything that makes it better or worse?
I noticed when I'm around my cat, it's really runny.
Okay. Okay. Do you have any other symptoms that go along with it? Coughing?
It's like itchy. My nose is itchy.
Itching? Okay. Do you have any watery eyes?
Sometimes, yeah.
Sometimes.
Mhm.
Okay. So just some questions about your history. Do you have any medication allergies that you know of?
Nope.
Any food allergies? Environmental allergies?
Nope.
Okay. Did you get the cat recently?
Yeah, I got him it was like a month ago, so not
Okay.
recently.
Okay. But definitely it's been, the runny nose has started after having the
Yeah,
cat
I
in the
think
house?
so, yeah.
Okay.
Uh-huh.
Okay. Any other medical problems?
No.
Things you've been treated for in the past?
No.
Any surgeries? Okay. Have you ever been pregnant?
Nope.
Okay. When was your last menstrual period?
I think it was like 2 weeks ago.
Okay, good. Any abnormal discharge you've noticed other than menstruation?
No.
Good. Any psychiatric history?
No.
Mental health history? Okay.
Mm-mm.
Do you know when your last pap smear was?
I had it, I think it was last summer.
Okay, good. So we're up to date with that. And how about your vaccines?
Yeah, and I got my flu shot last month.
Perfect. I love to hear that. So family history, do you have any family history of medical illness and your mother, father, grandparents?
My mom, I know she has high blood pressure. I know my grandma, she has, her blood sugar is high, diabetes, is that what it's called? Yeah. And then my brother, he has asthma.
Okay.
Yeah.
Okay. Good. Any smoking or use of any other form of tobacco?
No, I don't use tobacco.
Any drugs, including marijuana?
No.
Any alcohol? Drinking alcohol?
Maybe once a week.
Okay. So socially?
Yeah.
Okay. Perfect. So I'm just going to kind of ask you some general questions about your whole body.
Okay.
Okay. Any fevers or chills?
No.
I already asked you about the coughing. You said you had some sneezing. Or have you been having any fatigue?
No.
Feel like you're getting enough sleep?
Yeah.
Any night sweats?
No.
Any rashes or any new moles or lesions that you've noticed?
No.
Okay, good. Have you traveled recently?
Mm-mm.
Okay.
No.
Any earaches,
No.
nausea, vomiting, abdominal pain?
No.
Going to the bathroom okay?
Yep.
No issues there?
Yep.
Okay, good. All right, so I'm going to go ahead and start the head to toe exam, starting with your skin. And I would be examining my patient's skin throughout the exam as we go from system to system. But just from what I can see, her skin is pink, dry, and intact, and warm. Okay. She has good skin turgor, and her hair distribution is normal, with normal texture. Her nails, looking at her nails, they're smooth, they're not clubbed. She has good capillary refill under 2 seconds. Okay, so next I'm going to just palpate your head.
Okay.
I'm looking for any kind of abnormalities in shape, any lumps or bumps. Let me know if you have any tenderness.
Okay.
Okay, any tenderness with
No.
that? Okay. Next I'm looking at your face for symmetry. And so I'm going to have you kind of make some funny faces now. So I'm going to have you puff your cheeks out and smile really big. Brown and close your eyes really tight and open. Okay, good. Everything was symmetrical there, and that was testing cranial nerve 7. Next, I'm going to inspect your nose. And at this time, I'm going to have you go ahead and plug one nostril and breathe in through your nostril. And the other side. Okay, so it sounds like I've got a little bit of congestion in there with that runny nose.
Yeah.
Okay. Next, I'm going to palpate your sinuses. Okay, the frontal. Okay, ethmoid and maxillary. Do we have any pain there?
No.
Okay. Next, I'm going to palpate the TMJ. So you can go ahead and open and close and clench. Good. No clicking or popping. And while I'm here, I'm just going to palpate your mastoid bone behind the ear. Okay, no tenderness. Okay, next I'm going to inspect your eyes. I'm looking at eyelashes, looking to see if there's any eyelid drooping. Your eyes are symmetrical. That's good. Looking at your sclera. They're white. A little bit of bloodshot. Probably just from being tired, yes, from all the runny nose. Yeah. Okay. And then I'm going to have you pull down your eyelids for me, looking at the conjunctiva. They're nice pink. And I'm also looking at her iris and pupil and cornea here externally as well. Okay, so I'm going to my pen light and I'm going to check your extraocular eye movements. So I'm going to have you look at the pen light and follow it with your eyes. Okay. Cardinal fields of gaze. Okay, good. And that was all normal, checking cranial nerves 3, 4, and 6. Next, I'm going to check the pupillary light response. So I'm going to shine this bright light in your eyes, have you just look right over my shoulder. And I'm looking to make sure we have direct consensual reaction to light. And then for accommodation, I'm going to have you look at my pen light and then look over my shoulder. Okay, looking to make sure her eyes are accommodating near and far. Okay, next I'm going to get my ophthalmoscope and we're going to do an internal examination of your eye. Okay, so, backwards, okay. So first I'm going to be, setting this to 0, I'm going to be looking for the red light reflex, okay, which I see, and then I'm going to come in closer, be looking at the retina, looking for the vasculature, the macula. All looks good. Okay, I'm going to go to the other side. Again, looking for that red light reflex, looking inside the eye, the retina for the vasculature and the macula, optic disc, and it all looks great. Okay, so that's it for the eyes. We'll move on to the ears. Get this ready. But first I'm going to just inspect, looking at the pinna, looking here at the lobe, everything looks clean. Okay, look symmetrical, no cysts or anything felt. So I'm going to go ahead and look inside your ear. Okay, so I'm going to pull back and out. Looking at the tympanic membrane for it to be pearly gray and the cone of light. Good. Other side. And let me know if I'm putting it in too far, if it's causing discomfort. Okay. Looking for that. Again, cone of light and pearly gray tympanic membrane. Bless you. Okay. So that was the internal inspection of the ear. I'm going to do a couple of hearing tests. The first is the Weber test. So I'm going to ping this tuning fork and place it on top of your head and let me know if you heard on both sides or one side more than the other.
I can hear it on both sides.
Perfect. Okay, and next is the Rin test. And at this time I'm going to ping the tuning fork. I'm going to place it behind your ear and tell me when you stop hearing. Okay. And then I'm going to place it in front of your ear and tell me when you stop hearing.
Okay. Okay. Okay.
Okay, good. And we want the air conduction to be twice as long as the bone conduction, and that is histine cranial nerve 8, which is intact, and we would do that on the other side as well. Okay, next is the nose. We've already inspected the nares, looking for patency. I'm going to use my otoscope to just take a look up inside your nose. Okay, don't sneeze on me. Okay, I'm looking. Wait, turn off. Okay, I'm looking at the nasal passages, looking for the color, making sure that the septum is intact, and looking at the turbinates. And it looks like you have a little bit of drainage. Looks clear. So I'm not too concerned with that just yet. The next thing we're going to look at is the mouth. So I'm going to grab my tongue blade. So I'm going to have you open your mouth and say ah. Okay, and I would check her gag reflex by touching the back of her throat with the tongue blade, and that would be checking cranial nerve 9 and having her say ah. Cranial nerve 10, looking at the back of the throat, up the hard palate, uvula, and tonsils, which all look wonderful, and having her move her tongue side to side, up and down. I also want to look under the tongue. Okay, great. All right, so I'm going to, oh no. Next be inspecting the neck. So I'm going to have you turn your head to the side. I'm looking for any pulsations, jugular vein distension, looking at the carotid for any pulsations, any lumps. I don't see any. So I'm going to go ahead and palpate. I'm going to palpate the lymph nodes. Feeling for any lumps. Okay. And then I'm also going to palpate for her thyroid. So I'm going to have you take a swallow for me. Sorry. I would give her water for that. On the other side. Swallow. Thank you. Okay. And I don't feel any enlargement in the thyroid. Okay. Next, I'm inspecting her thorax. So I'm looking at her front, looking for symmetry, also, assessing her effort in breathing, respiratory rate and depth and those kind of things. Also inspecting the back of her thorax for the same things, and looking at her AP diameter, having her AP diameter be 1 to 2, which it is. Okay, so I'm going to go ahead and first auscultate your heart sounds. So go ahead and just breathe normally and listen to all the heart sounds first with the diaphragm, aortic, pulmonic, second pulmonic or Erb's point, tricuspid, and mitral. And then I listen to the same with the bell, aortic, pulmonic, second pulmonic, tricuspid, and mitral. Okay, and they all sound great. Okay, next, while I'm here in the front, I'm going to go ahead and listen for your lung sounds too. So I'm going to have you take a deep breath for me, starting all the way up at the apex of the lung. Lung sounds anteriorly are clear. I'm going to also listen on the back. So I'll have you turn side for our viewers here. Okay, deep breaths. Let me get those lateral positions as well here. Okay. Before I move on to further checking of the respiratory system on the back, I also would have included in my inspection of the chest, looking for the PMI, which is the point of maximal impact, and also feeling for that as well. Okay, so I've listened to the back. All the breath sounds are clear. I'm going to also assess for respiratory excursion. So I'm going to have her take a deep breath. Good, and looking for that symmetry of chest movement, which is symmetrical. And I'm going to also percuss for diaphragmatic excursion, where I would have the patient take a deep breath in and hold it. Percussing down from resonance to dole. Go ahead and breathe. I would mark that, and then have her take a deep breath out and hold it, and percuss up from dullness to resonance and mark that, and then measure it looking for 3 to 5 centimeters, and I would do that again on the other side and compare. Also, while I'm back here, I'm going to check for tactile fremitus, having the patient say 99,
99, 99, 99, 99, 99.
Good. And while I'm also back here, I'm going to check for CVA tenderness. Any pain?
No.
Okay. Patient does not have any CVA tenderness. Okay, so we'll have you go ahead and turn back around to the front. As part of the cardiovascular exam, we're also looking at all the peripheral pulses. So I would feel for the carotid pulse on both sides, one at a time. Other peripheral pulses we may check would be the brachial, radial, femoral, popliteal is also an option, and then dorsalis pedis and posterior tibial pulses. So I would check them all for strength and symmetry. Okay. I'm also going to auscultate carotid bruits. Have you hold your breath. Good. No bruits noted. Okay. So at this point, we'll go ahead and move on to the abdomen. So I'll have you lay back for me. Okay. So I would expose the abdomen and inspect. I'm looking for symmetry, looking for scars, any rashes or lesions, because again, we're assessing the skin throughout the whole exam. I'm going to have you lift your head for me, looking for any protrusions. That would mean a hernia. I don't see any. So after inspection, I'm going to auscultate all 4 quadrants for bowel sounds. And our patient's bowel sounds are normal. I would also auscultate for bruits over the aorta, renal, iliac, and femoral arteries. Next, I'm going to just lightly palpate all 4 quadrants. Sorry, my hands are cold. Okay. Any tenderness with that? Oh, good. Okay. And then I could do deeper palpation as well. I'm actually going to go ahead and palpate the liver. So I'm going to put one hand under and then have you take a deep breath in. Okay, I'm feeling for the liver edge. That should be smooth, and it is. And if she had any pain with that, which I would see in her face most likely, that would be a positive Murphy sign for gallbladder inflammation. Okay, and while I'm palpating here, I'm going to go ahead and palpate for the aorta. Okay, and I'm going to do a couple of appendicitis special tests. The first being the psoas, where I would have a patient straighten her leg and lift it up, and I'm going to push down on your leg and you push up against my hand. Okay, and if she had pain, that would be a positive sign. And then the obturator, I'm actually going to have you flex your hip, and then I would rotate the leg in and out, And if she had pain in her right lower quadrant, that would be a positive obturator sign. Okay, so that's done with the abdomen. Have you sit up, and we're just going to do a couple other neurological tests before we move on to musculoskeletal.
Okay.
So for cranial nerve 2, that's our visual acuity test. I would use the Snellen chart against the wall with 20 feet or the Rosenbaum at 14 inches and have her read the lowest line that she could to check visual acuity. I'm also going to check cranial nerve 11 by having you shrug your shoulders against my arms and turn your head against my hand. Other side. Good. Okay. To check for cerebellar function, I'm going to have you do the finger to nose. So I'm going to have you hold your hands out and touch your nose with one finger at a time. Good. Okay, the next is rapid alternating movements. So put your hands right on your knees and then flip them up and down. Go fast. Good. Okay. Good coordination. So then I'm going to have you put your heel to your shin and draw a line up to your knee and down, and same on the other side. Good. Okay, so we're going to have you stand up. We'll do a couple of standing tests here. And the first is called the Romberg test. And so I'm going to have you put your feet together and your arms at your sides and close your eyes. And I'm looking for any swaying. And with my arm behind her for safety, I can give her a little tiny push, and she's able to hold her balance well, so that's a negative Romberg test. Next, I'm going to assess her gait. So I'm going to have you walk normally to the corner there, and then walk back for me. Okay, and then I'm going to have you walk on your heels. Okay, and then come back to me on your toes. Good. And then I'm going to have you walk heel to toe. Good. So she has a good gait and balance. Okay. Then I'll have you do just a shallow knee bend. Okay, excellent. All right, so before I have you sit down, I'm going to have you turn around and look at your spine. So I'm looking for spine alignment. I'll have you bend over for me, making sure that the spine is aligned and doesn't have any curvatures, which it does not. Okay, go ahead and stand up for me. Any tenderness? Anything? Nope. Okay, good. So I'll have you come sit down for me. Okay, so we're going to do next some sharp and dull sensation tests. Okay, so I'm going to test this on your face and your arms and your legs. Okay. So I'll show you what it feels like first. Okay, so this is sharp and this is dull. Okay. Okay, so close your eyes for me. Start with your face.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay.
Sharp.
I would have her pants off for this.
Sharp. Sharp.
Okay, and then I would do the same on the other side to compare. Next, I'm going to check your sensation of vibration. So I'm going to ping the tuning fork and check your thumbs. Yep, and the big toe on each foot.
Yep. Yep.
Okay, excellent. All right, next we're going to check your reflexes. Okay, so I'm going to start with the bicep. Good, and your brachioradialis. Okay, and we'll do your tricep. Just relax your arm for me. Excellent. Okay, and then the patellar. Okay, and the Achilles behind the foot. And then the Babinski or plantar reflex, drawing a line up from heel to toe, looking for the toes to curl as being a negative Babinski sign. And then we'll do the same on the other side. Okay, tricep, patellar, Achilles, and plantar. Okay. So that's it for the reflexes. You have great reflexes. So now we're going to do range of motion. So we'll start with the neck. I'm going to have you look from side to side, ear to shoulder, and up and down. And let me know if you have any pain with any of those movements. Okay. Next is the shoulder. So I'm going to have you put your arms out to the side and then in front of you and all the way up. Okay, and down. All right, so good range of motion in the shoulder. Elbows, wrists, fingers, any pain in any of those joints? No. Excellent. Okay. Next, I'll go ahead and do your knees. So flex and extend, palpating the joints. Any pain?
No.
Okay, she has good range of motion in her knees. Go ahead and wiggle your feet around. Good range of motion in all her toes and ankles as well. And then for your hips, can you just rotate them out for me? Any popping or clicking or pain?
No.
Good. All right, so her range of motion is great. For muscle strength, I'm going to have you squeeze my hands. Good, equal strength. And then go ahead and pull against my hands and push. Good. Okay. And then push up against my hands and down. All right, so her strength is equal on both sides. Next, let's see, we're going to do the McMurray exam. So we're going to do a couple of different exams for your knees and shoulders. Okay. So I'm going to go ahead and have you lay back again. Okay, so we're going to do several tests looking at the meniscus and the ligaments in your knee. Okay, so McMurray's, we're just going to do some range of motion while I press here. Any pain with that movement?
No.
All right, good. So I would do all of these tests on both sides to compare. The next is the varus and valgus exam. So I'm looking again for that pain in the knee. So I press the knee in and pull out, looking for any pain. No pain?
No.
Okay, just not having any pain. That's great. Next is the anterior drawer exam. So I'm going to have you bend your knee. Okay, and I'm going to support your lower leg here with this hand and actually pull towards me with this hand. I'm looking to see if there's any movement here in the joint that is abnormal, and I don't see any, so it would be a negative test. Okay, so that's it for the knee. Now you sit up and we're going to do some shoulders. Okay, so the first is the Apley scratch test. So I'm actually going to have you put your arm behind your back like you're trying to scratch it. Good, and the other side. Okay, so that's negative. The next is the empty can test. Okay, and these are all looking for rotator cuff injuries. So I'm going to have you put your arms out in front of you at 45-degree angle. And like you're holding a can, I'm going to have you tip it over and empty it. Okay, so I'm going to press down on your arm and you resist it. Okay, looking for any pain caused by that. You could also do it with a full can. Okay, and again, you would do that on both sides. Then we have the drop arm test. So I'm going to have you raise your arms up above your head and then slowly drop them to the side. Okay, and if her arm was not able to have controlled slow movement down, if perhaps here it dropped, then that would be a positive test for a supraspinatus injury. Okay, and then we have the apprehension test. This is the last test for the shoulder. So I'm going to have your arm out here at a 90-degree here and rotate it backwards, looking at her face for any reaction indicating pain with that movement, and there's not, so that's good. And two more tests. These two are both for carpal tunnel. The first is the tennis, where I'm actually going to tap on the carpal tunnel, looking for any pain or tingling when that happens. Okay, and then Phelan's, where you'll actually bend your wrists at a 90-degree angle, and if that causes any numbness or tingling or pain, does not. We do not have carpal tunnel syndrome. Okay. And that is it. Thank you very much.
Thank you.
Do you have any questions or concerns?
No.
All right. We'll see you at your next visit.
Okay, thank you.
Okay, thank you.